Question 1. The monitoring system demonstrates a consistent pattern of elevated levels of a specific airborne particulate matter in a particular work area, exceeding established occupational exposure limits for short durations during specific operational cycles. What is the most appropriate approach for a certified environmental, safety, and health trainer to take in identifying and assessing the impact of this hazard? Option A. Focus on addressing the immediate symptoms reported by workers, such as minor respiratory irritation, and recommend the use of personal protective equipment without further investigation into the root cause or specific exposure levels. Option B. Immediately implement a general ventilation upgrade for the entire facility, as elevated particulate levels are a clear indication of a widespread air quality problem requiring a broad solution. Option C. Classify the hazard as low risk because there have been no reported serious injuries or illnesses directly attributed to this particulate matter in the past. Option D. Analyze the monitoring data to determine the specific operational cycles and tasks associated with the elevated particulate levels, investigate the potential sources of the particulate, and evaluate the potential health effects on exposed workers based on the duration and concentration of exposure, prioritizing further investigation and control measures for the highest potential impact. Correct answer is D. Analyze the monitoring data to determine the specific operational cycles and tasks associated with the elevated particulate levels, investigate the potential sources of the particulate, and evaluate the potential health effects on exposed workers based on the duration and concentration of exposure, prioritizing further investigation and control measures for the highest potential impact. Explanation: this scenario is professionally challenging because it requires a trainer to interpret complex data from a monitoring system and translate it into actionable hazard identification and risk assessment, all while adhering to specific regulatory requirements. The trainer must not only understand the technical aspects of the monitoring system, but also the implications for worker safety and environmental protection under the relevant regulatory framework. The pressure to provide accurate and timely information for training and corrective actions necessitates a rigorous and well-justified approach. The correct approach represents best professional practice because it directly aligns with the principles of hazard identification and impact assessment as mandated by environmental, safety, and health regulations. It involves a systematic process of analyzing the data, identifying potential hazards, evaluating their severity and likelihood, and then prioritizing them based on their potential impact. This ensures that resources are focused on the most significant risks, thereby fulfilling the trainer's ethical and regulatory duty to protect workers and the environment. This approach is proactive and data-driven, which is a cornerstone of effective EHS management. An incorrect approach that focuses solely on immediate, obvious symptoms without investigating the root cause fails to meet regulatory requirements for thorough hazard identification. It is ethically deficient as it may overlook underlying systemic issues that could lead to more severe incidents. This approach is reactive rather than proactive, which is contrary to the preventative principles embedded in EHS regulations. Another incorrect approach that prioritizes hazards based on the ease of implementing controls, rather than their potential impact, is also professionally unacceptable. This can lead to neglecting high-risk hazards simply because they are more difficult to mitigate, thereby failing to adequately protect workers and the environment. This demonstrates a lack of commitment to the core EHS mandate and can result in regulatory noncompliance and ethical breaches. A third incorrect approach that dismisses potential hazards due to a lack of historical incidents is flawed because it relies on past occurrences rather than a forward-looking assessment of potential risks. Regulations often require anticipating future risks, not just reacting to past ones. This approach can lead to complacency and a failure to identify emerging hazards, which is a significant regulatory and ethical failure. The professional decision-making process for similar situations should involve a structured approach. 1. Understand the regulatory context. Clearly identify the applicable EHS regulations and their specific requirements for hazard identification and impact assessment. 2. Data analysis. Thoroughly analyze all available data from monitoring systems, incident reports, and other relevant sources. 3. Hazard identification. Systematically identify all potential hazards based on the analyzed data, considering both immediate and latent risks. 4. Impact assessment. Evaluate the potential severity of harm and the likelihood of occurrence for each identified hazard. 5. Risk prioritization. Rank hazards based on their assessed risk level, focusing on those with the highest potential impact. 6. Control measures. Develop and recommend appropriate control measures to eliminate or reduce identified risks. 7. Communication and training. Effectively communicate findings and recommendations to relevant stakeholders and incorporate them into training programs. 8. Review and continuous improvement. Regularly review the effectiveness of control measures and update hazard assessments as new information becomes available. Question 2. Cost-benefit analysis shows that implementing a full global harmonized system, GHS, compliant labeling and safety data sheet, SDS, program will incur upfront costs for new labels and training materials. However, a trainer is considering different strategies to present this to management. Which approach best balances regulatory compliance, worker safety, and long-term operational efficiency? Option A. Focus on the immediate cost savings by suggesting the use of existing labeling systems with minor modifications, arguing that the risk of non-compliance is low for the majority of chemicals. Option B. Propose a phased implementation, starting with the most hazardous chemicals, to spread the initial cost over a longer period, acknowledging that full compliance might take longer. Option C. Highlight the potential for increased efficiency in inventory management and material handling due to standardized hazard information, in addition to meeting regulatory requirements. Option D. Emphasize how a comprehensive GHS implementation will significantly reduce the likelihood of chemical-related incidents, thereby lowering potential workers' compensation claims and associated downtime, while ensuring full compliance with hazard communication standards. The correct answer is D. Emphasize how a comprehensive GHS implementation will significantly reduce the likelihood of chemical-related incidents, thereby lowering potential workers' compensation claims and associated downtime, while ensuring full compliance with hazard communication standards. Explanation. This scenario is professionally challenging because it requires a trainer to balance the immediate financial implications of implementing a new safety system with the long-term benefits of enhanced worker protection and regulatory compliance. The trainer must not only understand the technical aspects of the Global Harmonized System, GHS, but also its practical application and the strategic advantages it offers beyond mere compliance. Careful judgment is required to advocate for the most effective and ethically sound approach. The correct approach represents best professional practice because it prioritizes worker safety and comprehensive hazard communication, which are fundamental ethical and regulatory obligations under GHS. By focusing on a thorough understanding and implementation of GHS pictograms, signal words, hazard statements, and precautionary statements, the trainer ensures that employees receive clear, consistent, and actionable information about chemical hazards. This proactive stance minimizes the risk of incidents, reduces potential liability, and fosters a stronger safety culture, aligning with the core principles of environmental, safety, and health training. An incorrect approach that focuses solely on the cost of new labels without considering the broader implications of GHS implementation fails to meet regulatory requirements. This oversight can lead to non-compliance, fines, and more importantly, a failure to adequately inform workers about chemical risks, potentially resulting in injuries or illnesses. Another incorrect approach that suggests using existing, non-GHS compliant labeling systems to save money ignores the legal mandate for GHS adoption and the ethical imperative to provide accurate hazard information. This approach creates a significant risk of miscommunication and inadequate worker protection. A third incorrect approach that advocates for a superficial understanding of GHS, focusing only on basic pictogram recognition without delving into the nuances of hazard statements and precautionary statements, is also professionally unacceptable. This superficiality undermines the effectiveness of the system, leaving workers vulnerable to hazards they may not fully comprehend. Professionals should use a decision-making framework that begins with a thorough understanding of the regulatory requirements, in this case, GHS, as mandated by relevant authorities. This should be followed by an assessment of the potential risks and benefits of different implementation strategies, always prioritizing worker safety and compliance. Ethical considerations, such as the duty to protect workers from harm, should guide the decision-making process, ensuring that cost-saving measures do not compromise safety standards. Question 3. The assessment process reveals that a new, semi-routine manufacturing process has been implemented with potential for ergonomic and chemical exposure hazards. As the certified environmental, safety, and health trainer, you are tasked with conducting a hazard analysis. You have limited time and resources, but must ensure a robust assessment. Which method would be the most appropriate and ethically sound to initiate the hazard identification process for this specific scenario? Option A: relying solely on historical incident reports from similar but not identical processes to infer potential hazards. Option B: implementing a full hazard and operability study, HAZOP, which is typically used for complex process systems. Option C: a job hazard analysis, JHA, to systematically break down the process steps, identify hazards at each stage, and recommend controls. Option D: conducting a high-level overview of the process without detailing individual steps or potential exposures. Correct answer is C: a job hazard analysis, JHA, to systematically break down the process steps, identify hazards at each stage, and recommend controls. Explanation: this scenario presents a professional challenge because the trainer must balance the immediate need for a comprehensive safety assessment with the practical constraints of time and resources. The ethical dilemma arises from the potential for a superficial analysis to overlook critical hazards, leading to an unsafe work environment and potential harm to employees. Careful judgment is required to select the most appropriate hazard analysis method that aligns with regulatory expectations and effectively addresses the identified risks. The correct approach represents best professional practice because it prioritizes a systematic and thorough evaluation of potential hazards associated with a specific task. Job hazard analysis, JHA, is designed to break down a job into its component steps, identify hazards at each step, and recommend controls. This method is highly effective for routine or semi-routine tasks and directly addresses the need to understand the risks of specific operational procedures, aligning with general occupational safety and health principles that mandate hazard identification and control. An incorrect approach that focuses solely on a high-level overview without detailed task breakdown fails to meet the regulatory expectation of identifying specific hazards and implementing appropriate controls. This could be seen as a failure to conduct a diligent hazard assessment, potentially violating general duty clauses or specific standards requiring task-specific risk assessments. Another incorrect approach that relies only on past incident reports neglects potential new or emerging hazards that may not have been previously documented, demonstrating a lack of proactive risk management. Ethically, this is problematic as it relies on reactive measures rather than preventative ones. A third incorrect approach that uses a method not suited for the complexity or nature of the task, such as a HAZOP for a simple manual task, would be an inefficient use of resources and might not yield the necessary detailed insights, indicating a lack of professional judgment in method selection. Professionals should use a decision-making framework that begins with understanding the scope and nature of the task or process to be analyzed. They should then consider the available resources, the criticality of the task, and the potential severity of hazards. Regulatory requirements and industry best practices for hazard analysis methods should be consulted. The chosen method should be capable of identifying hazards relevant to the specific operational context and facilitating the development of effective control measures. This involves a critical evaluation of the strengths and limitations of different hazard analysis techniques in relation to the specific situation. Question 4. What factors determine the specific environmental regulations and standards that a certified environmental, safety, and health trainer, CET, must prioritize when developing training materials for a manufacturing facility? Option A: general environmental awareness principles and common industry best practices for pollution prevention. Option B: the trainer's personal experience and familiarity with environmental issues in unrelated industries. Option C: the facility-specific industrial processes, the types of raw materials and chemicals used, and the nature of its waste streams and emissions. Option D: the perceived cost-effectiveness of implementing various environmental controls and training modules. The correct answer is C: the facility-specific industrial processes, the types of raw materials and chemicals used, and the nature of its waste streams and emissions. Explanation: This scenario is professionally challenging because a trainer must navigate the complexities of environmental regulations to ensure compliance and protect both the environment and the workforce. The trainer's responsibility extends beyond simply relaying information. It involves fostering a culture of safety and environmental stewardship. Careful judgment is required to identify the most pertinent regulatory requirements for a given situation, as misinterpretation or omission can lead to significant legal penalties, environmental damage, and reputational harm. The correct approach represents best professional practice because it directly addresses the core of regulatory compliance by focusing on identifying the specific environmental regulations applicable to the facility's operations. This involves a thorough understanding of the facility's activities, the substances it handles, and the potential environmental impacts. By consulting relevant federal, state, and local environmental laws and standards, the trainer can accurately identify the legal obligations and best practices that must be communicated to trainees. This proactive and specific approach ensures that training is targeted, effective, and legally sound, aligning with the ethical duty to provide accurate and comprehensive safety and environmental information. An incorrect approach that focuses solely on general environmental principles without identifying specific regulations is professionally unacceptable. This failure stems from a lack of regulatory specificity, which can lead to overlooking critical legal requirements. For instance, a facility might be subject to specific air emission standards under the Clean Air Act or wastewater discharge limits under the Clean Water Act, which general principles would not adequately cover. This oversight constitutes a regulatory failure, as it does not equip trainees with the knowledge to comply with legally mandated controls. Another incorrect approach that relies on industry best practices without verifying their regulatory backing is also professionally flawed. While industry best practices are valuable, they are not always legally binding. Relying on them exclusively without confirming their alignment with or exceeding regulatory minimums can result in non-compliance if the best practice falls short of legal mandates. This represents an ethical failure to adequately inform trainees of their legal obligations, potentially exposing the company to penalties. A further incorrect approach that prioritizes cost-effectiveness over regulatory adherence is a significant professional and ethical failing. Environmental regulations are designed to protect public health and the environment, and prioritizing cost savings over compliance undermines these fundamental objectives. This approach can lead to deliberate or negligent violations of environmental laws, resulting in severe legal consequences and environmental harm. The professional decision-making process for similar situations should involve a systematic approach. 1. Understand the operational context. Thoroughly assess the facility's processes, materials, and potential environmental impacts. 2. Identify applicable regulatory frameworks. Determine which federal, state, and local environmental laws and standards govern these operations. This may involve consulting agency websites, legal databases, and subject matter experts. 3. Cross-reference with industry standards. Review relevant industry best practices to identify opportunities for exceeding minimum regulatory requirements, but always prioritize legal mandates. 4. Develop targeted training. Design training programs that specifically address the identified regulatory requirements and their practical application within the facility. 5. Continuous review and update. Regularly review and update training materials to reflect changes in regulations and operational practices. Question 5. When evaluating a situation where a new chemical process has introduced a potential airborne contaminant in a manufacturing area, and production managers are concerned about delays in implementing new safety protocols, which approach best aligns with regulatory compliance and best practices for an environmental, safety, and health trainer? Option A. Advise production managers that the risk is minimal and can be managed through occasional air monitoring and relying on workers to report any discomfort, as formal protocol implementation would significantly impact production schedules. Option B. Suggest deferring any formal hazard assessment or control implementation until after the current production surge is complete to avoid any operational interruptions. Option C. Prioritize the implementation of engineering controls to contain the contaminant at its source, followed by administrative controls to limit exposure duration. And finally, ensure appropriate personal protective equipment is available and used, all while documenting the risk assessment and control measures. Option D. Recommend immediate mandatory use of respirators for all personnel in the area, as this is the quickest way to address the potential exposure without disrupting current production workflows. The correct answer is C. Prioritize the implementation of engineering controls to contain the contaminant at its source, followed by administrative controls to limit exposure duration. And finally, ensure appropriate personal protective equipment is available and used, all while documenting the risk assessment and control measures. Explanation: this scenario is professionally challenging because it requires the trainer to balance the immediate need for operational efficiency with the long-term imperative of regulatory compliance and worker safety. The pressure to meet production targets can create a conflict of interest, where shortcuts might seem appealing but carry significant risks. Careful judgment is required to prioritize safety and compliance over short-term gains. The correct approach represents best professional practice because it directly addresses the identified hazard through a systematic and compliant process. It involves a thorough risk assessment, which is a fundamental requirement under environmental, health, and safety regulations. Implementing engineering controls first, followed by administrative controls, and then personal protective equipment, PPE, aligns with the hierarchy of controls, a universally recognized principle in occupational safety and health. This approach minimizes risk at the source, is more reliable than relying solely on worker behavior, and ensures that all legal and ethical obligations are met. The commitment to ongoing training and review reinforces a culture of safety and continuous improvement, which is crucial for maintaining compliance and preventing future incidents. An incorrect approach that focuses solely on immediate production without addressing the root cause of the hazard fails to meet regulatory requirements for hazard identification and control. It creates an environment where risks are merely managed, not eliminated or minimized, leading to potential violations and increased likelihood of incidents. Relying exclusively on PPE without implementing higher-level controls is a regulatory failure because it does not adequately protect workers and often represents a less effective control measure. It places the burden of safety primarily on the individual worker rather than on the employer's responsibility to provide a safe working environment. Another incorrect approach that involves ignoring the hazard to avoid disruption is a direct contravention of legal duties to provide a safe workplace and can lead to severe penalties, including fines and legal action, in addition to the ethical failure of endangering workers. Professionals should use a decision-making framework that begins with understanding the relevant regulatory framework and its specific requirements for hazard identification, risk assessment, and control. This should be followed by a thorough assessment of the identified hazard, considering its potential severity and likelihood. A hierarchy of controls should then be applied to determine the most effective and compliant control measures. Documentation of all steps, including risk assessments, control implementation, and training, is essential for demonstrating compliance and for future reference. Finally, a commitment to continuous monitoring and review ensures that controls remain effective and that the workplace remains safe and compliant. Question 6. Operational review demonstrates a consistent pattern of minor deviations from a critical safety procedure during a specific manufacturing process, which have not resulted in any reported incidents to date. The production supervisor suggests that these deviations are minor, do not pose an immediate risk, and that the focus should remain on meeting production targets. As the certified environmental, safety, and health trainer, what is the most appropriate best practice approach to address this situation? Option A. Advise the production supervisor that while the deviations are noted, the lack of reported incidents indicates the current procedure is overly stringent and may need to be relaxed to improve efficiency. Option B. Initiate a formal investigation to determine the root cause of the deviations, assess the potential for future incidents, and develop targeted corrective actions, including potential retraining or procedural adjustments. Option C. Document the deviations in the operational log but take no further immediate action, as no incidents have occurred and the supervisor has deemed them minor. Option D. Issue a general reminder to all employees about the importance of following the critical safety procedure without investigating the specific reasons for the ongoing deviations. The correct answer is B. Initiate a formal investigation to determine the root cause of the deviations, assess the potential for future incidents, and develop targeted corrective actions, including potential retraining or procedural adjustments. Explanation: This scenario presents a common challenge for environmental, safety, and health professionals, balancing immediate operational demands with long-term compliance and risk mitigation. The challenge lies in the potential for a seemingly minor deviation from established procedures to escalate into a significant compliance failure, leading to regulatory penalties, reputational damage, and most importantly, increased risk to worker health and safety. The pressure to maintain production schedules can create a conflict of interest, requiring the ESH trainer to exercise sound professional judgment and a thorough understanding of applicable regulations. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based evaluation of the deviation. By initiating a formal investigation and root cause analysis, the trainer is adhering to the principles of proactive ESH management. This aligns with the spirit and intent of regulatory frameworks, which emphasize continuous improvement and the prevention of incidents. Specifically, under U.S. regulations, assuming this is the jurisdiction for the CET exam, this approach is supported by OSHA General Duty Clause, Section 5(a)(1) of the OSH Act, which requires employers to provide a workplace free from recognized hazards. A formal investigation is the mechanism to identify and address such hazards. Furthermore, it aligns with the principles of a robust ESH management system, often guided by standards like ISO 45001, which mandate incident investigation and corrective actions. An incorrect approach that focuses solely on the immediate operational impact, without a thorough investigation, fails to address the underlying systemic issues that led to the deviation. This is a regulatory failure because it neglects the employer's responsibility to identify and control hazards. Ethically, it prioritizes expediency over safety and compliance. Another incorrect approach, which involves simply reiterating existing policy without investigating the cause of non-compliance, is also a failure. This demonstrates a lack of understanding of effective training and enforcement, as it does not address why the policy was not followed. It is a superficial response that is unlikely to prevent recurrence. Finally, an approach that dismisses the deviation as insignificant without proper assessment is a critical failure. This demonstrates a lack of due diligence and a potential underestimation of risk, which can lead to serious consequences and is contrary to the proactive stance required by regulatory bodies. The professional decision-making process for similar situations should involve a structured approach. 1. Recognize and document the deviation. 2. Assess the immediate risk and implement interim controls if necessary. 3. Initiate a formal investigation to determine the root cause. 4. Evaluate the effectiveness of existing controls and training. 5. Develop and implement corrective and preventive actions. 6. Communicate findings and actions to relevant stakeholders. 7. Monitor the effectiveness of implemented actions. This systematic process ensures that deviations are not just addressed, but understood and prevented from recurring, thereby upholding regulatory compliance and fostering a safer work environment. Question 7. Stakeholder feedback indicates that some operational teams are struggling to consistently apply DOT hazardous materials transportation regulations, leading to concerns about compliance and safety. As the Certified Environmental, Safety and Health Trainer, CET, what is the most effective and professionally responsible approach to address this feedback? Option A. Conduct a general refresher training session for all employees involved in hazardous materials transportation, redelivering the standard curriculum without investigating the specific nature of the feedback received. Option B. Implement a strict disciplinary policy for any identified instances of noncompliance with DOT hazardous materials regulations, citing the stakeholder feedback as evidence of a need for stricter enforcement. Option C. Schedule a series of follow-up training sessions with operational supervisors and key personnel to collaboratively review the existing training materials, identify specific areas of confusion or difficulty in practical application, and co-develop targeted improvements to the training content and delivery methods. Option D. Immediately revise the Hazardous Materials Training Manual to include more detailed legal interpretations and advanced regulatory nuances to ensure absolute technical accuracy, without further consultation with operational teams. The correct answer is C. Schedule a series of follow-up training sessions with operational supervisors and key personnel to collaboratively review the existing training materials, Identify specific areas of confusion or difficulty in practical application, and co-develop targeted improvements to the training content and delivery methods. Explanation. This scenario presents a common implementation challenge in hazardous materials transportation training, ensuring consistent understanding and application of complex regulations across different operational units. The challenge lies in bridging the gap between regulatory requirements and practical, day-to-day operations, especially when feedback suggests a disconnect. A trainer's role is to not only impart knowledge, but also to facilitate its effective implementation, addressing real-world barriers. The correct approach represents best professional practice because it directly addresses the root cause of the stakeholder feedback by engaging those most affected and knowledgeable about operational realities. This collaborative method ensures that training is not only compliant but also practical, relevant, and sustainable. It aligns with the ethical responsibility of a trainer to provide effective and impactful education that promotes safety and compliance. By involving supervisors and operational staff, the trainer can identify specific areas of confusion or difficulty in applying DOT hazardous materials regulations, leading to targeted and more effective training solutions. This proactive and inclusive strategy fosters a culture of safety and continuous improvement. An incorrect approach that focuses solely on redelivering the existing training without investigating the feedback is professionally unacceptable. This fails to acknowledge the validity of stakeholder concerns and risks perpetuating the same issues. It demonstrates a lack of responsiveness and an inability to adapt training to meet evolving operational needs, potentially leading to continued noncompliance and safety risks. Ethically, it neglects the trainer's duty to ensure training is effective. Another incorrect approach that involves implementing a punitive disciplinary action for noncompliance based on the feedback, without first addressing potential training deficiencies, is also professionally unacceptable. This reactive measure can create a climate of fear, discourage open communication about challenges, and fail to address the underlying cause of noncompliance, which may be a lack of understanding or resources rather than willful disregard. It is a failure to apply a constructive and educational approach to safety management. A third incorrect approach that involves updating the training materials to include more complex legal jargon without consulting operational staff or supervisors is professionally unsound. While seemingly addressing the regulatory aspect, it ignores the practical application and understanding of the material by the intended audience. This can lead to training that is technically accurate but functionally useless, further alienating stakeholders and failing to improve compliance. A professional decision-making process for similar situations should involve a systematic approach. First, actively listen to and analyze stakeholder feedback to understand the specific nature of the challenges. Second, collaborate with operational staff and supervisors to identify the root causes of any identified gaps in understanding or application of regulations. Third, develop and deliver targeted training solutions that are practical, relevant, and address these specific issues. Finally, establish mechanisms for ongoing feedback and evaluation to ensure the continued effectiveness of training and compliance efforts. Question 8. Process analysis reveals that a certified environmental, safety and health trainer, CET, is tasked with developing and delivering a comprehensive safety training program for a company with facilities in multiple states, each operating under a different state-approved OSHA plan. The trainer has identified that, while federal OSHA standards provide a baseline, some state plans have unique or more stringent requirements. The company is seeking a cost-effective solution that minimizes training development time. Considering the ethical obligations and regulatory responsibilities of a CET, which approach to developing this multi-state training program is most professionally sound and compliant. Option A. Develop a single training program that addresses the most stringent requirements found across all applicable state OSHA plans, ensuring compliance and the highest level of worker protection in every location. Option B. Prioritize the development of a training program that aligns with the least stringent state OSHA plan, as this will be the most efficient and easiest to implement across all facilities. Option C. Create a training program based solely on federal OSHA standards, assuming that state plans are generally equivalent, and that this will satisfy the majority of requirements while being cost-effective. Option D. Design separate minimal training modules for each state, focusing only on the unique requirements of each state plan to reduce overall training content and development time. The correct answer is A. Develop a single training program that addresses the most stringent requirements found across all applicable state OSHA plans, ensuring compliance and the highest level of worker protection in every location. Explanation: this scenario presents a professional challenge because a certified environmental safety and health trainer, CET, must navigate the complexities of differing state OSHA plans while ensuring consistent and effective safety training across multiple work sites. The ethical dilemma arises from the potential for a trainer to prioritize expediency or cost savings over the most robust safety standards, or to inadvertently create confusion by applying inconsistent training protocols. Careful judgment is required to balance regulatory compliance, operational efficiency, and the paramount goal of worker safety. The correct approach represents best professional practice because it prioritizes a thorough understanding of each state's specific OSHA plan requirements. This involves actively researching and comparing the standards, enforcement policies, and any additional state-specific regulations that may exceed federal OSHA requirements. By developing training materials and delivery methods that meet or exceed the most stringent applicable state plan, the CET ensures that all employees receive the highest level of protection, regardless of their work location. This proactive and comprehensive approach aligns with the ethical obligation of a safety professional to safeguard worker well-being and upholds the integrity of the CET certification by demonstrating a commitment to regulatory adherence and best practices. An incorrect approach that focuses solely on federal OSHA standards without considering state-specific variations is professionally unacceptable. This fails to meet the legal requirements of states with approved OSHA plans, which often have more stringent or specific regulations than federal OSHA. This can lead to noncompliance, citations, fines, and most importantly, inadequate worker protection, creating a significant ethical failure. Another incorrect approach that attempts to create a single, generic training program for all states, assuming all state plans are identical, is also professionally flawed. This ignores the fundamental purpose of state OSHA plans, which is to allow states to tailor their occupational safety and health programs to their unique industries and needs. Such an approach risks overlooking critical state-specific requirements, leading to compliance gaps and potential safety hazards. A third incorrect approach that prioritizes the least burdensome or least costly training requirements across all states is ethically and professionally unsound. While efficiency is important, it must never come at the expense of worker safety. This approach demonstrates a disregard for the regulatory intent of state OSHA plans and a failure to uphold the primary responsibility of a safety professional to protect human life and health. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify all relevant jurisdictions where training will be conducted. 2. For each jurisdiction, identify the applicable OSHA regulatory framework, federal or state-approved plan. 3. Conduct a detailed comparative analysis of the identified regulatory frameworks, noting any differences in standards, enforcement, or specific requirements. 4. Determine the most stringent or comprehensive set of requirements that will apply across all relevant jurisdictions. 5. Develop and implement training programs that meet or exceed these most stringent requirements. 6. Regularly review and update training programs to reflect any changes in regulations or best practices. 7. Document all research, analysis, and training activities to demonstrate due diligence and compliance. Question 9. The performance metrics show a significant reduction in reported ergonomic injuries and a decrease in the frequency of musculoskeletal complaints following the implementation of a new training program focused on proper lifting techniques and workstation setup. However, the training completion rate for this program is only 75%, and post-training assessments indicate that a portion of employees still struggle with certain biomechanical principles. Which of the following represents the most effective approach for the certified environmental, safety, and health trainer to evaluate the overall success of this training initiative? Option A. Advocate for continued delivery of the current training program, emphasizing the need for refresher sessions and targeted interventions for employees struggling with specific concepts, while continuing to monitor injury and complaint trends. Option B. Recommend immediate cessation of the training program due to the incomplete completion rate and the ongoing struggles with biomechanical principles, focusing resources on a different hazard category. Option C. Conclude the training was highly successful based on the reduction in ergonomic injuries and musculoskeletal complaints, and consider the 75% completion rate acceptable given the positive outcomes. Option D. Shift the focus of the evaluation to the number of hazards identified during ergonomic assessments, assuming that a reduction in injuries directly correlates with a decrease in the number of identified hazards. The correct answer is B. Recommend immediate cessation of the training program due to the incomplete completion rate and the ongoing struggles with biomechanical principles, focusing resources on a different hazard category. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the trainer to move beyond simply identifying hazards to evaluating the effectiveness of training interventions based on observed performance. The trainer must critically assess whether the training provided is actually mitigating risks, which involves understanding the nuances of different hazard types and their impact on worker behavior and safety outcomes. This requires a deep understanding of the regulatory framework and how it applies to practical safety management. Correct approach analysis. The correct approach demonstrates best professional practice by directly linking training effectiveness to observable performance metrics and hazard reduction. This aligns with the principles of a proactive safety culture, which emphasizes continuous improvement and data-driven decision-making. Regulatory frameworks, such as those enforced by OSHA in the U.S., mandate employers to provide effective training that ensures employees can perform their duties safely. Evaluating training based on reduced incidents and improved safe work practices is the most direct way to confirm compliance and demonstrate the value of EHS training. This approach is ethically sound as it prioritizes worker well-being by ensuring training is not just a formality, but a genuine tool for risk mitigation. Incorrect approaches analysis. One incorrect approach fails by focusing solely on the completion of training modules without assessing their impact. This is a regulatory failure because it suggests compliance with the *act* of training rather than the *effectiveness* of training, which is the underlying intent of regulations. Ethically, it is a failure to adequately protect workers if the training is not leading to safer practices. Another incorrect approach is to focus on the number of hazards identified during inspections, irrespective of whether those hazards are related to the training provided. While hazard identification is crucial, this approach misdirects the evaluation of training effectiveness. Regulations require training to address *specific* risks employees face. If training is not directly contributing to the reduction of identified hazards, its efficacy is questionable, representing a potential regulatory and ethical lapse in resource allocation and risk management. A third incorrect approach is to solely rely on employee feedback regarding the perceived quality of the training. While feedback is valuable, it is subjective and does not directly measure the reduction of physical, chemical, biological, ergonomic, or psychosocial hazards. Regulations and best practices demand objective evidence of risk reduction. Relying only on subjective feedback is an ethical failure, as it prioritizes perceived satisfaction over actual safety outcomes, and a regulatory failure to demonstrate effective hazard control. Professional reasoning. Professionals should adopt a data-driven approach to training evaluation. This involves establishing clear performance indicators, KPI, before training is delivered, such as incident rates, near-miss reports, or observed safe work practices related to the specific hazards covered. After training, these KPIs should be re-evaluated to measure the impact. This systematic process allows for the identification of training gaps and areas for improvement, ensuring that EHS training is a dynamic and effective component of the overall safety management system. This aligns with the continuous improvement cycle mandated by many regulatory bodies and ethical obligations to protect worker health and safety. Question 10. The efficiency study reveals that a manufacturing facility's current safety training program, while compliant with federal OSHA standards, may not fully address specific environmental and occupational health concerns mandated by the state and local authorities where the facility operates. Which approach best ensures the training program's overall effectiveness and compliance? Option A. Prioritize training on the most recently updated federal guidance documents, as these are generally considered the most current and authoritative. Option B. Rely on the assumption that state and local regulations mirror federal requirements, thus no additional research beyond federal standards is necessary. Option C. Conduct a comprehensive review of all applicable state and local environmental, safety, and health regulations to identify any specific requirements that supplement or supersede federal standards and integrate these into the training program. Option D. Assume that federal OSHA standards are sufficient for all training purposes, as they represent the baseline for worker safety and health across the nation. The correct answer is C. Conduct a comprehensive review of all applicable state and local environmental, safety, and health regulations to identify any specific requirements that supplement or supersede federal standards and integrate these into the training program. Explanation: this scenario is professionally challenging because it requires a trainer to navigate the complexities of differing regulatory requirements at the state and local levels, which can sometimes conflict or overlap with federal standards. The trainer must ensure compliance with all applicable laws, not just the most prominent or easily accessible ones. Careful judgment is required to identify and interpret these specific state and local mandates, which often address unique environmental, safety, or health concerns pertinent to a particular region. The correct approach represents best professional practice because it prioritizes a thorough and proactive investigation into all relevant state and local regulations. This demonstrates a commitment to comprehensive compliance and due diligence, which is a cornerstone of effective environmental, safety, and health training. By actively seeking out and understanding these specific requirements, the trainer ensures that the training program is not only legally sound, but also tailored to the actual risks and operational context of the facility within its specific jurisdiction. This proactive stance minimizes the risk of noncompliance and protects both the organization and its employees. An incorrect approach that relies solely on federal OSHA standards fails to acknowledge the supremacy of state and local regulations when they are more stringent or cover areas not addressed by federal law. This is a significant regulatory failure, as many states operate their own OSHA-approved state plans, which must be at least as effective as federal OSHA, but can be more comprehensive. Ethically, it represents a failure to adequately protect workers by potentially overlooking critical local safety and health provisions. Another incorrect approach that focuses only on the most recently updated federal guidance overlooks the possibility that state or local regulations may have been updated independently and could impose additional or different requirements. This approach is procedurally flawed and risks noncompliance with existing, potentially more stringent, state or local mandates. It demonstrates a lack of thoroughness and a failure to maintain a comprehensive understanding of the regulatory landscape. A third incorrect approach that assumes all state and local regulations are identical to federal ones is a dangerous generalization. This demonstrates a fundamental misunderstanding of the decentralized nature of regulatory enforcement in the U.S. and a failure to perform necessary due diligence. It is a direct abdication of the trainer's responsibility to provide accurate and jurisdictionally relevant information, leading to potential legal and safety liabilities. The professional decision-making process for similar situations should involve a systematic approach. First, identify the primary federal regulatory framework applicable to the industry and operations. Second, determine if the state operates an OSHA-approved state plan. If so, research that state's specific OSHA standards. Third, investigate any relevant local ordinances or regulations that may impose additional or specific requirements related to environmental, safety, or health matters. Finally, cross-reference all findings to ensure the training program addresses the most stringent and comprehensive set of requirements across all applicable levels of government. Question 11. The performance metrics show a persistent issue with worker exposure to airborne dust during a specific manufacturing process, leading to increased respiratory complaints. As a certified environmental, safety, and health trainer, which approach to controlling this hazard best aligns with the principles of process optimization and the hierarchy of controls? Option A. Implementing a comprehensive local exhaust ventilation system at the dust generation points and redesigning the process to minimize dust release. Option B. Investigating the feasibility of replacing the current material with a less dusty alternative or redesigning the process to eliminate dust generation entirely. Option C. Providing workers with high-efficiency particulate air HEPA respirators and conducting regular fit testing sessions. Option D. Developing a strict rotation schedule for workers performing the dust-generating tasks to limit individual exposure duration. The correct answer is A. implementing a comprehensive local exhaust ventilation system at the dust generation points, and redesigning the process to minimize dust release. Explanation: the performance metrics show a persistent issue with worker exposure to airborne dust during a specific manufacturing process. This scenario is professionally challenging because it requires a trainer to not only identify the problem, but also to recommend the most effective and compliant control measures. The trainer must consider the hierarchy of controls, a fundamental principle in occupational safety and health, to ensure worker protection while also optimizing process efficiency and minimizing disruption. The correct approach represents best professional practice because it prioritizes the most effective controls according to the hierarchy of controls, as mandated by general occupational safety and health principles, and often reflected in regulatory guidance. Eliminating the dust-generating step or substituting the material with a less hazardous alternative are the most effective methods, as they remove the hazard at its source. If these are not feasible, engineering controls, such as local exhaust ventilation, are the next most effective, physically isolating workers from the hazard. This aligns with the proactive and preventative nature of effective safety and health management. An incorrect approach that relies solely on administrative controls, such as limiting exposure time, fails to address the root cause of the hazard. Ethically, this places the burden of risk management on the worker rather than the employer. Regulatory failure occurs because it does not adequately reduce exposure to acceptable levels and may violate permissible exposure limits if they exist. Another incorrect approach, focusing only on personal protective equipment, PPE, is also professionally unacceptable. While PPE is a necessary last line of defense, relying on it as the primary control measure is a failure of the hierarchy of controls. It is often the least effective, can be prone to user error, and does not eliminate the hazard. Ethically, it can be seen as a way for employers to appear compliant without making substantive changes to the work environment. Regulatory failure stems from not implementing higher-level controls as required by many safety regulations. The professional reasoning process for similar situations should involve a systematic evaluation of the hazard, followed by a thorough assessment of control options based on the hierarchy of controls. This includes 1. Identifying and characterizing the hazard, 2. Brainstorming all potential control measures, 3. Evaluating each control measure against the hierarchy: elimination, substitution, engineering controls, administrative controls, PPE, 4. Selecting the most effective and feasible combination of controls, prioritizing higher-level controls, 5. Documenting the decision-making process and the rationale for the chosen controls, 6. Implementing, monitoring, and reviewing the effectiveness of the controls. Question 12. The risk matrix shows a high likelihood of a minor environmental incident occurring during routine maintenance operations. As a certified environmental, safety, and health trainer, CET, which of the following approaches would be most effective in optimizing the process to prevent such incidents? Option A. Emphasize the importance of completing maintenance tasks as quickly as possible to minimize operational downtime, assuming minor incidents are manageable. Option B. Implement a system for immediate reporting and investigation of all environmental incidents, regardless of severity, to gather data for future analysis. Option C. Increase the frequency of general safety meetings to reinforce overall safety awareness among maintenance staff. Option D. Develop and deliver targeted training modules focusing on specific maintenance procedures, spill prevention techniques, and emergency response protocols relevant to the identified high-risk activities. Correct answer is D. Develop and deliver targeted training modules focusing on specific maintenance procedures, spill prevention techniques, and emergency response protocols relevant to the identified high-risk activities. Explanation: the risk matrix shows a high likelihood of a minor environmental incident occurring during routine maintenance operations. This scenario is professionally challenging because it requires a trainer to balance the immediate need for operational efficiency with the long-term imperative of preventing environmental harm. The trainer must not only identify potential risks, but also implement effective strategies to mitigate them, ensuring compliance with environmental regulations and promoting a culture of safety. The correct approach represents best professional practice because it directly addresses the identified high-risk area through targeted training and process refinement. By focusing on specific maintenance procedures and incorporating best practices for spill prevention and containment, the trainer is proactively mitigating the likelihood and potential impact of an incident. This aligns with the principles of environmental stewardship and regulatory compliance, aiming to prevent harm before it occurs. This proactive stance is a cornerstone of effective environmental, safety, and health management. An incorrect approach that relies solely on post-incident reporting fails to meet regulatory expectations for proactive risk management. Environmental regulations often mandate preventative measures and hazard identification, not just reactive responses. This approach also ethically falls short by not adequately protecting the environment or the organization from potential liabilities. Another incorrect approach that prioritizes speed of maintenance over thoroughness overlooks the critical link between operational procedures and environmental risk. This can lead to shortcuts that increase the likelihood of spills or improper waste handling, directly contravening environmental protection laws and best practices. Ethically, it demonstrates a disregard for environmental responsibility. A third incorrect approach that involves infrequent, general safety briefings without specific focus on the identified high-risk maintenance activities is insufficient. While general awareness is important, it does not provide the detailed knowledge and practical skills needed to prevent specific environmental incidents during maintenance. This approach fails to adequately address the documented risk and therefore does not meet the trainer's responsibility to ensure a safe and environmentally sound workplace. Professionals should use a decision-making framework that begins with a thorough understanding of the risk assessment, as indicated by the risk matrix. This understanding should then guide the development of targeted training and procedural improvements. The process involves identifying specific hazards, evaluating existing controls, and implementing enhanced measures. Regular review and feedback loops are crucial to ensure the effectiveness of these interventions and to adapt to changing conditions or new information. This systematic and proactive approach ensures compliance, minimizes risk, and fosters a culture of continuous improvement in environmental, safety, and health performance. Question 13. Compliance review shows a significant safety hazard identified during a routine workplace inspection, directly contravening a specific OSHA standard. As a certified environmental, safety, and health trainer, CET, what is the most appropriate immediate procedural step to address this violation? Option A. Document the hazard and the specific standard violated, formally notify the employer's management of the noncompliance, and advise on the potential penalties and the necessity for prompt corrective action as outlined in the relevant OSHA regulations. Option B. Advise the employer that the hazard is minor and likely to be overlooked by inspectors, suggesting they monitor the situation informally. Option C. Recommend that the employer conduct an internal investigation and decide on the appropriate course of action without formal reporting to any external body. Option D. Immediately issue a written warning to the responsible department and assess a provisional fine based on the perceived severity of the hazard, pending further review. The correct answer is A. Document the hazard and the specific standard violated, formally notify the employer's management of the noncompliance, and advise on the potential penalties and the necessity for prompt corrective action as outlined in the relevant OSHA regulations. Explanation. This scenario is professionally challenging because it requires the Certified Environmental Safety and Health Trainer, CET, to navigate the complexities of regulatory enforcement and penalty structures without resorting to assumptions or external information. The CET must demonstrate a thorough understanding of the specific violation procedures and penalty frameworks applicable under the relevant regulatory body, likely OSHA in a U.S. context for a CET exam. The core challenge lies in accurately identifying the appropriate procedural steps and penalty considerations based solely on the presented violation, without overstepping the bounds of their training expertise into legal interpretation or enforcement authority. The correct approach represents best professional practice because it directly addresses the regulatory requirement for reporting and follow-up actions associated with an identified violation. It emphasizes the CET's role in facilitating compliance and ensuring that the employer understands the potential consequences, aligning with the trainer's responsibility to educate and guide. This approach prioritizes adherence to established procedures for addressing violations, which typically involve documentation, notification, and potentially the initiation of corrective actions, all within the framework of the governing regulations. An incorrect approach that focuses on immediate, self-imposed penalties or punitive measures is a significant regulatory and ethical failure. The CET is not an enforcement agency and lacks the authority to levy fines or impose penalties directly. Such an approach misinterprets the CET's role, which is educational and advisory, not punitive. Another incorrect approach that involves ignoring the violation or downplaying its significance is also a failure. This demonstrates a lack of commitment to safety and health, potentially leading to further noncompliance and increased risk to employees, which is contrary to the ethical obligations of a safety professional and the spirit of regulatory oversight. A third incorrect approach that involves solely relying on the employer's self-assessment without any formal reporting or follow-up mechanism fails to ensure accountability and proper regulatory engagement, potentially allowing the violation to persist unaddressed. The professional decision-making process for similar situations should involve a clear understanding of the CET's scope of authority and responsibilities. First, accurately identify the nature of the violation and its potential severity based on regulatory guidelines. Second, consult the relevant regulatory framework to determine the prescribed procedures for reporting and addressing such violations. Third, communicate the findings and potential consequences clearly and factually to the employer, emphasizing the need for corrective action and compliance. Fourth, document all findings and communications meticulously. Finally, understand when to escalate issues to appropriate enforcement agencies if the employer fails to take adequate corrective action, but always within the established procedural channels. Question 14. Market research demonstrates that many organizations are seeking to enhance their occupational safety and health (OSH) programs by adopting more robust risk assessment methodologies. As a certified environmental, safety and health trainer, CET, you are tasked with advising a multinational company on how to integrate the principles of relevant ILO conventions into their existing risk assessment framework. Which of the following approaches best aligns with the spirit and intent of ILO conventions concerning occupational safety and health? Option A. Implementing a risk assessment process that prioritizes the identification and control of hazards in accordance with the principles outlined in ILO conventions such as the Occupational Safety and Health Convention, 1981, No. 155, and the Framework Convention for the Promotion of Occupational Safety and Health, 2006, No. 187, ensuring a proactive and preventative approach to worker well-being. Option B. Focusing risk assessments solely on meeting the minimum legal requirements of each country where the company operates, without explicit consideration of broader international best practices or preventative principles. Option C. Utilizing a risk assessment approach that relies on historical incident data alone, without incorporating forward-looking, hazard identification and proactive risk mitigation strategies. Option D. Adopting a risk assessment methodology that emphasizes cost-saving measures, even if it means a less comprehensive identification or control of potential hazards, to ensure financial viability. The correct answer is A. Implementing a risk assessment process that prioritizes the identification and control of hazards in accordance with the principles outlined in ILO conventions such as the Occupational Safety and Health Convention, 1981, No. 155, and the Framework Convention for the Promotion of Occupational Safety and Health, 2006, No. 187, ensuring a proactive and preventative approach to worker well-being. Explanation: this scenario is professionally challenging because it requires the Certified Environmental, Safety and Health Trainer, CET, to navigate the application of international labor standards within a specific organizational context, balancing the aspirational goals of ILO conventions with practical implementation. The trainer must not only understand the principles of risk assessment, but also how these principles are informed by and should align with internationally recognized best practices for worker protection. The correct approach represents best professional practice because it directly integrates the principles of risk assessment with the overarching framework provided by relevant ILO conventions. Specifically, it acknowledges that ILO conventions, such as those concerning occupational safety and health, e.g., C-155, C-187, and the promotion of safety culture, provide a foundational ethical and legal imperative for comprehensive risk assessment. This approach ensures that the risk assessment process is not merely a procedural exercise, but is guided by a commitment to preventing work-related injury and ill health, as advocated by international labor standards. It prioritizes worker well-being and aligns with the spirit of continuous improvement inherent in these conventions. An incorrect approach that focuses solely on immediate legal compliance without considering the broader ethical and preventative mandates of ILO conventions fails to embrace the proactive and protective spirit of these international instruments. This can lead to a superficial risk assessment that meets minimum legal requirements but does not adequately protect workers or foster a robust safety culture. Another incorrect approach that prioritizes cost-effectiveness over the thorough identification and control of hazards, even if technically compliant with some regulations, violates the ethical obligation to safeguard worker health and safety, a core tenet of ILO conventions. Such an approach risks significant harm and reputational damage. A third incorrect approach that relies on outdated or incomplete risk assessment methodologies, ignoring advancements and best practices promoted by ILO standards, demonstrates a failure to stay current and to uphold the highest standards of EHS practice. This can result in overlooked risks and inadequate protective measures. Professionals should employ a decision-making process that begins with understanding the specific context and applicable regulatory framework, including any international standards that provide guidance or set benchmarks. They should then identify the core principles of the task at hand, risk assessment, and how these principles are enhanced or mandated by the broader EHS framework. This involves critically evaluating different approaches to ensure they are not only compliant, but also ethically sound and aligned with best practices for worker protection, as championed by organizations like the ILO. The process should involve a continuous cycle of assessment, implementation, review, and improvement, informed by both national regulations and international guidance. Question 15. The assessment process reveals a manufacturing facility with potential for fugitive emissions, wastewater discharge, and generation of hazardous waste. The trainer must determine the most effective initial step in a risk assessment to ensure compliance with EPA regulations, considering the potential for accidental releases and their environmental impact. Option A. Prioritize the assessment of air emissions, as these are often the most visible and regulated aspects of environmental compliance. Option B. Focus exclusively on the historical record of past spills and releases to understand the facility's environmental liability. Option C. Compile a comprehensive list of all reporting requirements under each EPA statute without first understanding the specific risks the facility faces. Option D. Identify potential release points for all environmental media and determine which EPA statutes, Clean Air Act, Clean Water Act, ARCRA, CERCLA, are most likely to apply to these potential releases. The correct answer is D. Identify potential release points for all environmental media and determine which EPA statutes, Clean Air Act, Clean Water Act, ARCRA, CERCLA, are most likely to apply to these potential releases. Explanation. This scenario presents a professional challenge because it requires a trainer to interpret and apply complex EPA regulations, Clean Air Act, Clean Water Act, ARCRA, CERCLA in the context of a risk assessment, specifically focusing on identifying potential environmental hazards and their associated risks. The trainer must move beyond simply reciting regulations to understanding how they inform practical risk management strategies. The challenge lies in discerning which regulatory framework is most pertinent to the identified risks and how to effectively communicate these findings to stakeholders for appropriate action. The correct approach represents best professional practice because it directly aligns with the core principles of environmental risk assessment and the intent of EPA regulations. By prioritizing the identification of potential releases and their impacts under relevant statutes, it demonstrates a proactive and compliant stance. This approach ensures that the risk assessment is grounded in regulatory requirements, leading to informed decision-making for mitigation and prevention. It emphasizes understanding the what-if scenarios that trigger regulatory obligations, which is crucial for a trainer to effectively guide an organization. An incorrect approach that focuses solely on historical contamination without considering current operational risks fails to address potential future liabilities and ongoing compliance obligations under ARCRA or CERCLA. This is a regulatory failure because it neglects the proactive elements of environmental management and may overlook immediate hazards. Another incorrect approach that prioritizes only air emissions without assessing water or waste streams is a failure to conduct a comprehensive environmental risk assessment. This is a regulatory failure as it ignores the interconnectedness of environmental media and the potential for cross-contamination or violations under the Clean Water Act or RCRA. An approach that solely focuses on reporting requirements without understanding the underlying risks and regulatory triggers is also a failure. This is an ethical and regulatory failure because it prioritizes form over substance, potentially leading to a false sense of compliance while actual risks remain unaddressed. Professional decision-making in similar situations requires a systematic approach. First, thoroughly understand the operational context and potential sources of environmental impact. Second, identify potential hazards across all relevant environmental media: air, water, land, waste. Third, determine which EPA regulations, CA, CWA, RCRA, CERCLA, are most likely to be triggered by these hazards. Fourth, assess the likelihood and severity of potential releases and their environmental and human health consequences. Finally, communicate these findings clearly and concisely, recommending appropriate control measures and compliance strategies based on the identified risks and regulatory requirements. Question 16. The evaluation methodology shows that a certified environmental, safety and health trainer, CET, is developing training materials on waste management for employees operating in a specific city. The trainer has reviewed federal and state environmental regulations concerning hazardous waste disposal. Which of the following actions best ensures compliance with all applicable environmental requirements for this training? Option A. Assuming that the city's waste management ordinances are identical to those of the state, as most local regulations are simply restatements of higher-level laws. Option B. Relying on general environmental best practices and assuming that federal and state regulations encompass all necessary waste management requirements. Option C. Providing employees with a general overview of federal and state waste management laws and instructing them to research any local requirements independently. Option D. Directly consulting the official municipal code of the city and contacting the local environmental health department to clarify any specific local ordinances related to waste management. The correct answer is D. Directly consulting the official municipal code of the city and contacting the local environmental health department to clarify any specific local ordinances related to waste management. Explanation. This scenario presents a professional challenge because a trainer must interpret and apply local environmental ordinances, which can vary significantly in scope and enforcement from state or federal regulations. The trainer's responsibility is to ensure compliance not only with overarching laws, but also with the specific requirements of the municipality where the training is being conducted. This requires a nuanced understanding of how local rules interact with broader environmental mandates and the ability to translate these into practical training content. The correct approach represents best professional practice because it prioritizes a thorough and accurate understanding of the applicable local environmental ordinances. This involves directly consulting the official municipal code or relevant local government departments. By doing so, the trainer ensures that the training content is legally sound, relevant to the trainee's operational environment, and effectively addresses all local compliance obligations. This proactive and precise method minimizes the risk of non-compliance and demonstrates a commitment to responsible environmental stewardship and professional integrity. An incorrect approach that relies solely on general environmental principles or state-level regulations fails to acknowledge the specific jurisdiction of local ordinances. This is a regulatory failure because it overlooks legally binding requirements that may be more stringent or have unique stipulations not covered by broader laws. Ethically, it is a failure of due diligence, as the trainer is not providing complete and accurate information, potentially exposing the organization and its employees to penalties. Another incorrect approach that assumes local ordinances are identical to federal or state laws is a significant oversimplification and a direct contravention of jurisdictional compliance. This is a regulatory failure because it leads to the omission of critical local requirements. Ethically, it demonstrates a lack of professional rigor and an abdication of the responsibility to provide comprehensive and accurate training. A third incorrect approach that delegates the responsibility of understanding local ordinances to trainees without providing them with the correct information is also professionally unacceptable. This is a regulatory failure because it shifts the burden of compliance onto individuals who may not have the expertise or resources to accurately interpret and apply these specific local rules. Ethically, it is a failure to adequately prepare and equip trainees for their compliance responsibilities, potentially leading to unintentional violations. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the specific geographic location of operations or training. 2. Determine all applicable levels of environmental regulation, federal, state, and local. 3. Prioritize the acquisition of the most specific and current local ordinances relevant to the training topic. 4. Consult official sources for these ordinances, municipal websites, code books, local environmental agencies. 5. Integrate the findings from local ordinances into training materials, ensuring clarity and practical application. 6. Verify the accuracy and completeness of the training content with relevant local authorities if ambiguity exists. Question 17. The performance metrics show a significant increase in the number of near misses reported, but a slight decrease in recordable injuries and environmental noncompliance incidents over the past year, following the implementation of a new ESH management system aligned with international standards. Which approach to evaluating the effectiveness of this new system is most professionally sound? Option A. Prioritize the reduction in recordable injuries and environmental noncompliance incidents, suggesting that the increase in near misses might indicate an overly sensitive reporting threshold that could lead to unnecessary investigations and resource diversion. Option B. Conclude that the ESH management system is not fully effective because the increase in near misses suggests that hazards are still prevalent, and the reduction in incidents is likely due to a temporary reporting anomaly rather than a fundamental improvement. Option C. Analyze the increase in near misses as a positive indicator of a strengthened reporting culture and a proactive approach to hazard identification, while also examining trends in recordable injuries and environmental incidents to confirm the system's overall effectiveness in preventing harm. Option D. Focus on the decrease in recordable injuries and environmental noncompliance incidents as primary indicators of success, attributing the rise in near misses to increased reporting diligence rather than systemic issues. The correct answer is D. Focus on the decrease in recordable injuries and environmental noncompliance incidents as primary indicators of success, attributing the rise in near misses to increased reporting diligence rather than systemic issues. Explanation. This scenario presents a common implementation challenge where a company is attempting to align its environmental, safety, and health management system with an internationally recognized standard, such as ISO 14001 or ISO 45001, which are often referenced or adopted in various national regulatory frameworks for EHS professionals. The challenge lies in translating the broad principles of these standards into practical, measurable, and effective performance metrics that genuinely reflect improved ESH outcomes, rather than just procedural compliance. Professional difficulty arises from the need to balance the aspirational goals of international standards with the realities of operational constraints, resource limitations, and the diverse nature of ESH risks within an organization. Careful judgment is required to select metrics that are meaningful, achievable, and contribute to continuous improvement, avoiding the trap of vanity metrics that look good on paper but don't drive real change. The correct approach represents best professional practice because it focuses on establishing a direct link between the implemented ESH management system and tangible improvements in environmental performance and worker safety. By selecting metrics that are leading indicators of potential incidents or environmental excursions, and by ensuring these metrics are aligned with the specific significant environmental aspects and safety risks identified by the organization, it demonstrates a proactive and risk-based approach. This aligns with the core principles of international ESH management standards, which emphasize prevention, continuous improvement, and stakeholder engagement. Furthermore, using a combination of leading and lagging indicators provides a more holistic view of performance, allowing for early intervention and strategic adjustments. This approach is ethically sound as it prioritizes the well-being of people and the environment, and it is regulatorily compliant by demonstrating a commitment to fulfilling the intent of ESH legislation and international best practices. An incorrect approach that focuses solely on lagging indicators, such as the number of recordable injuries or environmental fines, fails to meet the proactive spirit of international standards. While these metrics are important for historical analysis, they do not provide early warning signals for potential future issues. Relying only on these can lead to a reactive ESH culture, where improvements are only made after an incident has occurred, which is a significant regulatory and ethical failure. Another incorrect approach that prioritizes metrics with readily available data, even if they are not directly related to significant ESH risks, represents a failure to conduct a thorough risk assessment and to implement a management system that is truly tailored to the organization's specific context. This can lead to a misallocation of resources and a false sense of security. Finally, an approach that focuses on compliance with the minimum requirements of the standard without striving for performance improvement misses the essence of continuous improvement, which is a cornerstone of international ESH management. This can be seen as a superficial adoption of the standard, lacking genuine commitment to ESH excellence. Professional decision-making in such situations requires a systematic process. First, thoroughly understand the organization's significant ESH aspects and risks. Second, consult the relevant international standards, e.g., ISO 14001, ISO 45001, and any applicable national regulations that may reference or adopt these standards. Third, identify potential metrics that can measure performance against these risks and aspects. Fourth, evaluate these potential metrics based on their relevance, measurability, achievability, and their ability to drive improvement, SMART criteria. Fifth, select a balanced set of leading and lagging indicators that provide a comprehensive view of ESH performance. Finally, establish a process for regular review and adjustment of these metrics to ensure they remain effective and aligned with evolving organizational needs and ESH objectives. Question 18. Market research demonstrates that workplace training effectiveness is significantly impacted by the accuracy of identifying airborne contaminants. A certified environmental, safety, and health trainer is observing a manufacturing process involving metal grinding and subsequent welding on the same materials. Airborne particles are visible in the air. Based on the physical characteristics of the airborne substances generated by these processes, which of the following approaches best ensures accurate classification for effective hazard control training? Option A. Differentiate between the airborne substances based on their formation process and physical state, e.g., solid particles from mechanical action vs. condensed metallic vapor particles vs. liquid droplets. Option B. Assume all airborne contaminants are fumes as welding is involved, and fumes are a common byproduct of welding. Option C. Classify all visible airborne particles as dust because grinding operations inherently produce dust. Option D. Focus solely on the chemical composition of the materials being ground and welded to determine the hazard. The correct answer is C. Classify all visible airborne particles as dust because grinding operations inherently produce dust. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a trainer to accurately identify and differentiate between various types of airborne contaminants, each with distinct physical properties and potential health impacts. Misidentification can lead to the selection of inappropriate control measures, inadequate training content, and ultimately, increased risk to workers. The trainer must apply their knowledge of the physical characteristics of contaminants to real-world workplace situations. Correct approach analysis. The correct approach involves a systematic evaluation of the physical characteristics of the airborne substance observed. This aligns with the fundamental principles of industrial hygiene and occupational safety training, which emphasize understanding the nature of the hazard to implement effective controls. For example, recognizing a substance as a fume implies it was formed by condensation from a gaseous state, often at high temperatures, and will typically be very fine particles. This understanding dictates specific ventilation and respiratory protection strategies that differ from those for mists, which are liquid droplets formed by atomization. This approach is directly supported by regulatory frameworks that mandate hazard identification and risk assessment based on the physical and chemical properties of substances present in the workplace. Incorrect approaches analysis. One incorrect approach would be to rely solely on the source of the contaminant without considering its physical state. For instance, assuming all contaminants from welding are fumes without observing their particle size and formation process could be inaccurate. Welding can also produce mists or even gases depending on the materials and processes used. This failure to differentiate leads to misclassification and potentially ineffective controls. Ethically, it represents a failure to provide accurate and relevant training. Another incorrect approach is to group all particulate contaminants together without distinguishing between dusts, fumes, and mists. Dusts are typically generated by mechanical processes like grinding or cutting, and their particle size can vary significantly. Fumes are much finer, often submicron. Mists are liquid droplets. Treating them as a single category overlooks critical differences in how they behave in the air, how they are inhaled, and the most effective control measures. This is a regulatory failure as it bypasses the detailed hazard characterization required by occupational safety standards. A further incorrect approach would be to focus only on the chemical composition of the substance and ignore its physical form. While chemical hazards are crucial, the physical state, dust, fume, mist, gas, vapor, dictates exposure routes, deposition in the respiratory tract, and the efficacy of control technologies. For example, a chemical that exists as a vapor at room temperature will require different containment and ventilation strategies than the same chemical if it were present as a mist. This approach is a significant ethical and regulatory failure, as it omits a critical component of hazard assessment: professional reasoning. Professionals should employ a decision-making process that begins with observing the workplace and the airborne substance. This observation should then be correlated with knowledge of the process generating the contaminant. The next step is to critically assess the physical characteristics of the airborne substance. Is it a solid particle, dust, fume? Is it a liquid droplet, mist? Is it a gas or a vapor? This assessment should be informed by an understanding of how each type of contaminant is formed and behaves. Based on this accurate identification, appropriate control measures and training content can be developed, ensuring compliance with relevant occupational safety and health regulations, and upholding the ethical responsibility to protect worker health. Question 19. Assessment of the most effective strategy for a manufacturing facility to address persistent issues with improper segregation of hazardous waste streams within its production areas, given limited space and varied employee training levels. Option A. Implement a comprehensive program including root cause analysis, targeted employee training on specific waste streams, improved labeling, provision of appropriate containers at generation points, and regular audits with feedback. Option B. Increase the number of hazardous waste accumulation containers throughout the facility without reassessing current segregation procedures or providing further employee education. Option C. Rely exclusively on the hazardous waste disposal contractor to identify and segregate all waste streams upon collection from the facility. Option D. Institute a strict disciplinary policy for any employee found missegregating waste without additional training or infrastructure changes. The correct answer is A. Implement a comprehensive program including root cause analysis, targeted employee training on specific waste streams, improved labeling, provision of appropriate containers at generation points, and regular audits with feedback. Explanation. Scenario analysis. This scenario presents a common implementation challenge in hazardous waste management, balancing the need for efficient waste stream segregation with the practical limitations of a facility's existing infrastructure and personnel training. The professional challenge lies in ensuring compliance with stringent regulatory requirements for hazardous waste identification, accumulation, and disposal while also considering operational feasibility and cost-effectiveness. A trainer must navigate potential conflicts between ideal regulatory practices and the realities of day-to-day operations, requiring careful judgment to avoid both non-compliance and unnecessary operational burdens. Correct approach analysis. The correct approach emphasizes a systematic, multifaceted strategy that directly addresses the core of the problem: inadequate segregation. It begins with a thorough assessment to understand the root causes of the current issues, which could range from insufficient training to poorly designed waste collection points. This is followed by targeted training that goes beyond general hazardous waste principles to cover specific waste streams generated by the facility and the correct segregation procedures for each. Implementing clear labeling and readily accessible, appropriate containers directly supports the training and makes correct segregation easier for employees. Finally, regular audits and feedback loops are crucial for reinforcing correct practices, identifying ongoing challenges, and ensuring continuous improvement. This approach aligns with the principles of RCRA Resource Conservation and Recovery Act, which mandates proper identification, management, and disposal of hazardous waste to protect human health and the environment. Ethically, it demonstrates a commitment to worker safety and environmental stewardship by proactively addressing a compliance gap. Incorrect approaches analysis. One incorrect approach focuses solely on punitive measures, such as disciplinary action, without addressing the underlying reasons for improper segregation. This fails to educate employees on correct procedures and can foster resentment, leading to a superficial compliance that doesn't solve the problem and may even encourage concealment of waste. This approach is ethically questionable as it punishes without providing the means to succeed and is regulatorily deficient because it doesn't ensure proper waste management practices are understood or implemented. Another incorrect approach involves simply purchasing more hazardous waste containers without reassessing the segregation process or providing adequate training. While more containers might seem like a solution, if employees don't understand which container to use for which waste, the problem of missegregation will persist, potentially leading to cross-contamination and increased disposal costs. This approach is a superficial fix that fails to meet regulatory requirements for accurate waste characterization and management, and it is ethically problematic as it doesn't prioritize employee understanding and safe practices. A third incorrect approach is to rely solely on external waste disposal contractors to identify and segregate waste upon pickup. While contractors play a vital role in disposal, the generator of the hazardous waste, the facility, retains primary responsibility for its proper identification, accumulation, and management up to the point of transfer. Shifting this responsibility to the contractor is a direct violation of RCRA regulations and an ethical abdication of responsibility for environmental protection and worker safety. Professional reasoning. Professionals faced with such challenges should employ a structured problem-solving approach. First, conduct a comprehensive root cause analysis to understand why the current segregation is failing. Second, develop and implement a training program tailored to the specific waste streams and personnel involved, ensuring clarity and practical application. Third, revise and improve the physical infrastructure for waste collection, including clear labeling and appropriate containers. Fourth, establish a system for ongoing monitoring, auditing, and feedback to ensure sustained compliance and continuous improvement. This systematic approach, grounded in regulatory requirements and ethical considerations, ensures effective and sustainable hazardous waste management. Question 20. Comparative studies suggest that when addressing a newly identified workplace hazard, a certified environmental, safety, and health trainer, CET, must recommend control measures. Considering the established hierarchy of controls, which of the following approaches demonstrates the most effective and professionally responsible recommendation for mitigating this hazard? Option A. Advocating for the implementation of engineering controls that physically isolate or remove the hazard from the worker's environment. Option B. Recommending the mandatory use of appropriate personal protective equipment (PPE) for all employees potentially exposed to the hazard. Option C. Implementing robust administrative controls such as enhanced training and strict work procedures to manage employee behavior around the hazard. Option D. Determining that the hazard is minor enough that no specific control measures are immediately necessary, pending further observation. The correct answer is C. Implementing robust administrative controls, such as enhanced training and strict work procedures, to manage employee behavior around the hazard. Explanation. This scenario is professionally challenging because it requires a trainer to balance the immediate need for hazard mitigation with the long-term goal of fostering a culture of safety that prioritizes the most effective control measures. The trainer must not only understand the hierarchy of controls, but also be able to articulate its importance and application in a way that resonates with management and employees, especially when cost or convenience might favor less effective methods. The correct approach represents best professional practice because it aligns directly with the fundamental principles of the hierarchy of controls, a cornerstone of environmental, safety, and health management. This hierarchy, as outlined in various regulatory frameworks such as OSHA General Duty Clause and specific standards, e.g., those related to process safety management or hazard communication, mandates that employers prioritize elimination and substitution of hazards, followed by engineering controls, administrative controls, and finally, personal protective equipment, PPE. By advocating for engineering controls first, the trainer is promoting a proactive and inherently safer design, which is ethically and regulatorily superior to relying on behavioral changes, or PPE, alone. This approach minimizes the potential for human error and provides a more robust and sustainable solution to the identified hazard. An incorrect approach that prioritizes administrative controls over engineering controls fails to adhere to the established hierarchy. Ethically, this is a failure to provide the highest level of protection reasonably achievable. Regulatorily, it could be seen as a violation of the General Duty Clause if a more effective engineering control was feasible and readily available, as it implies a less diligent effort to mitigate risk. Relying solely on PPE as the primary control measure is also a significant failure. Ethically, it places the burden of protection on the individual worker and is often the least effective control due to potential for improper use, failure, or noncompliance. Regulatorily, it is often considered a last resort and may not meet the standard of feasible or effective controls required by many regulations. An approach that suggests no controls are needed because the hazard is minor is a critical failure in risk assessment and hazard recognition, violating the fundamental duty to protect workers from recognized hazards, regardless of perceived severity. The professional reasoning process for similar situations involves a systematic risk assessment. First, identify the hazard. Second, evaluate the risk associated with the hazard, likelihood, and severity. Third, brainstorm potential control measures. Fourth, apply the hierarchy of controls to rank these measures from most to least effective. Fifth, select the most effective feasible control measure, prioritizing elimination, substitution, and engineering controls. Sixth, document the rationale for the chosen controls and implement them. Finally, monitor the effectiveness of the controls and reassess the risk periodically. This structured approach ensures that decisions are based on established safety principles and regulatory requirements, promoting a proactive and effective safety program.